The EVO ICL, I think, is revolutionary for a few different reasons. Number one, it's something that's completely reversible and removable. We've never had a technology or surgery that we can reverse later on after the fact when you compare it to LASIK, where we're actively removing tissue from the cornea and permanently making a change to someone's surface, nerves, and vision. Here you have a technology that, should it not work or should there be a change later on, it can be completely removed and kind of hit the reset button for patients. I think that's one big reason that we wanted to adopt it.
Prior to the launch of EVO, we had the Visian ICL, and so that required for PIs for patients. It was a pretty cumbersome task to, have a patient get a PI before, a week or two before cases and then schedule them for the surgery. It was painful. With the EVO version, we've now streamlined that, where we have these 5 different ports on the lens where it allows aqueous to flow through the eye. And so it's much safer, much more streamlined technology where, you can basically have a patient for a consult, get their measurements, and you can do surgery the next day.
It's perfectly safe. It's been FDA approved. We've never had anything like it. And it treats, a wide variety of patients. You may have someone that's a -3 but has very dry eyes and can't do LASIK, can't do contact lenses. And you can have someone that's maybe a -9 or a -12 where there is no other option to help them see better at that age but the EVO ICL.
LASIK's an amazing procedure, but this is another option for patients, just depending on their hobbies or just their eye prescription, to give them the visual freedom to get out of glasses or contacts.
I would say over 95% of our patients that we've done so far in our center have been 20/25 or better.
So my full name is Brenda Hernandez.
Ryan Koenig.
Tirzandita.
I've had the worst vision since I was in elementary school.
It's been forever. Blurry vision around 10 years old, but after when it was 12, it's just full on glasses.
I hated my glasses from a young age. I would always not wear them and then only wear them whenever I was close to the board. And I was also the student where I refused to sit close to the board, right? Because that's not for the cool kids.
Things are a little blurry, so it takes me a second to kind of focus in on something to read it, like a street sign. And then at night, I just have terrible vision. Lights kind of seem to be all spread out, and it's just terrible.
I swim less than before because it's kind of hard to see in the in the water and everything, and then I have to wear my glasses after on. It's just it's just maybe the sport wise. Also when you're sweaty, I think that's kind of things that a little bit troubled me.
And there was times where I'm rushing out of the house and I'm I have to go. And I'm oh, my contact, right? I have to be able to see to drive. And then my glasses would be broken. And it was just it would always be a lot of little inconveniences.
My dad had the LASIK procedure a few years ago, and I've thought about doing it ever since he got it.
I started going to gym, and I think my glasses kind of in a way at some point. So I was you know what? It will be nice for half of my life. I'm not wearing glasses anymore. There's one day I just scroll into Instagram, and then it just kept popping. I was you know what? I'm going to try it.
And they had a lot of really good reviews, and I was okay, I'll go ahead. I'll do my consultation. Did my consultation. Everybody was so sweet, and I think I appreciate that, especially because this is it was my first medical procedure. And so, right, you want people to be kind and answer all your questions. And I love questions. So I had so many of them, and they were so patient with all of my questions.
Very helpful, very informative, very nice.
One of the reasons we've developed our office-based surgery center is to be able to do the EVO ICL, to be able to fully embrace it, where we don't need anesthesia, we don't have expensive facility fees, and having to force patients to go to another hospital system just to get this procedure done. We see them here for their pre-op, we go down the hall, we are able to do their procedure right here, we see them the next day for post-op. It's the same people, the same doctor, same team that sees them throughout their process.
So I just got out from EVO ICL procedure, and then I got 20/20 vision.
I can already see, no glasses, no contacts.
I never thought I could have see like 20/20 vision after wearing glasses for 30 years.
It was a very good experience.
It's literally painless, nothing to worry about.
Meeting Dr. Irshad, he knows what he's doing. Very good guy, very knowledgeable. I would recommend this place.
For Dr. Irshad, thank you so much, and thank you for giving me details. And then the pre-op and post-op, you guys went through every single detail that helped us make us feel more comfortable with this EVO ICL procedure.
It's been a tremendous pleasure to just be a part of the EVO ICL Star Surgical. We are at the forefront of technology here. We're finding ways to continuously benefit our patients, to make sure that these patients are getting the results that we desire.
We want to be the place for patients to go no matter what their visual needs are. We want to be able to address it all. So if we have patients that would benefit from LASIK, we certainly have that. Some patients that may be in the military or can't have LASIK flaps and need PRK, we can do that all day long. We have other patients that may be a better candidate for an ICL or seeking ICL technology. We've been offering that for a while now. Beyond that, we do refractive lens exchange for other patients where we can give them the full range of vision and keep them from developing cataracts later on. And certainly we specialize in cataract surgery, laser cataract surgery with a wide variety of lenses to again give patients the best quality vision at all the different ranges possible, including the new light adjustable lens.